Welcome to this video that has been brought to you by the Lambeth Mental Health and Learning Disabilities team for SLAM. In this video we will introduce the Mental Capacity Act and talk about what this might look like for somebody with a learning disability and their family. The Mental Capacity Act is a law that looks at how adults make decisions in England and Wales. The law applies to everybody over the age of 16. It is there to protect vulnerable adults when it comes to decision making. Some people may be unable to make decisions by themselves and require somebody else to make decisions for them. There are some words we'll be using lots in this video. These are decision, capacity, and best interest. When we are talking about decisions, this applies to all decisions made from day-to-day choices about what to wear and what to eat to more serious decisions such as where to live or whether or not to have a medical procedure. Capacity means how well somebody is able to understand and be able to make a decision for themselves. If somebody is found to be unable to make their own decision, this is called lacking capacity. Best interests is the means by which a decision should be made on behalf of somebody who lacks capacity. We will talk some more about best interests later on in the video. There are 5 rules of the Mental Capacity Act. The first of these is that we must assume that somebody has capacity until it is proved that they don't. This is so that people are not judged to be incapable of making their own decisions based on things like having a learning disability. The second rule is that people must be fully supported to make decisions by themselves. This means making sure that person has had all the relevant information presented to them in a way that is accessible to them and has had support to reach their own decision. The third rule is that people are allowed to make unwise decisions. This means that just because a decision is made that may be considered to be unwise, it does not mean that that person lacks capacity. An example of an unwise decision could be if somebody decides to drink alcohol to excess despite implications for their health. Another example would be if somebody decides to spend a lot of money on a new computer, even if that means they may not have enough money for food. As long as that person understands the consequences of their decision, they must still be allowed to make it. The fourth rule is that any decisions made on behalf of somebody else must be in that person's best interest. This means taking into account that person's wishes and feelings and making a decision based on what is right for them. The final rule is that decisions made for somebody else must also be the least restrictive option. This means looking at the options which have the least limits on that person's freedom or rights. How can I help somebody to make their own decision? You could start by providing all information about the decision that is to be made. If we look at an example of deciding whether to have an injection or not, you would need to know the benefits of having that injection and the risks, when it might happen, who will be doing it, what the outcome of the injection would be, and if there were any alternatives. For example, having medication to calm any nerves before having the injection. You should communicate that information in an appropriate way for the person you are supporting. Does that person need information to be presented in an easy read format? Do they need an interpreter? Do they need pictures to understand what might happen? You can do everything you can to make that person feel relaxed and comfortable to make the decision for themselves. Is there a better time of day to have a conversation with somebody? Is there a particular place they could feel more comfortable to talk about it? It's important to think about if that decision could wait until somebody may feel more comfortable. For example, if somebody is unwell, can the decision wait until they are feeling better? You can provide that person with as much support as possible. Are there particular people they may feel more comfortable communicating with about the decision to be made? Are there other people in their support network that could also help that person to reach a decision? All of these things will help when supporting somebody to reach a decision by themselves. If, after trying all of these things, the person you are supporting is unable to reach a decision for themselves, it is possible that they will lack capacity. Assessing capacity. Who can assess capacity? Anybody can assess capacity, and the person that is assessing will likely be the person who is going to make that best interest decision. It's probable that you do assessments every day for the person you are supporting already, for everyday tasks such as deciding what clothes to wear that day or what they will have to eat at lunchtime. For more serious decisions, a professional can assess capacity using the 2-stage test. It is also important to remember that the Mental Capacity Act works on a decision-by-decision basis. This means that somebody may be able to choose what they want to eat or drink, but may be lacking capacity to decide how they spend their money. If a 2-stage test is carried out, this involves asking 2 questions in order to determine capacity. The first of these is there an impairment in the functioning of the brain of the person we are assessing? A learning disability would be an example of an impairment. The second question is, does this impairment result in that person lacking capacity? To decide this, we look at whether somebody can understand the information given to them, if the person is able to retain that information for long enough to make a decision, if they can weigh up their options and look at risks and consequences of decisions, and finally, if the person is able to communicate their decision. This can be in any form of communication and doesn't just have to be verbal. Sometimes we all agree or disagree to things by nodding or shaking our heads. If a person is found to be lacking capacity, then a best interest decision must be reached. For more formal decisions, such as where somebody should live or medical decisions, a best interest meeting should be held. This meeting should include all members of the support network of that person. This could include family members, staff support teams, GP or other medical professionals, and social workers. Because there are so many people in the meeting, there may be disagreements about what the best thing to do is. The focus for all decision making should be the wishes and interests of the person you are making a decision for. Carers who are with that person on a day-to-day basis are the best people to give information about what is important to that person. There are lots of things to consider when making a best interest decision, and the Mental Capacity Act sets out a checklist for this. The checklist includes involving the person as much as possible, understanding their wishes and feelings, thinking about least restrictive options, considering all the relevant information, and not to make assumptions based on things such as age, gender, appearance, or behaviour. If you are unhappy with the decision that's been made, either because of the outcome or the way the decision was made, there are some steps you can take. The first step would be to raise this informally with the person or organisation involved in the decision. They should be able to listen to your concerns and help you. If this is unsuccessful and you are still unhappy, you can make a formal complaint. Each organisation will have its own complaints procedures to follow. For social care, you can complain to the local authority. For healthcare, you can get advice about complaints from the Patient Advice and Liaison Service. If you are worried that a criminal offence may have occurred, you can report this to the police. If you are still unhappy, then the Court of Protection may be an option. The Court of Protection is a specialist court that makes decisions when adults lack capacity. It is usually the last resort when it comes to disagreements about capacity and decisions. They may become involved if the decision to be made is particularly complex, if there are strong disagreements which cannot be resolved, or if a deputy needs to be appointed to make decisions on somebody else's behalf. If you would like more information, you can visit any of these websites: MENCAP, British Institute of Learning Disabilities, Foundation for People with Learning Disabilities, or the government website and search for mental capacity. There will be a link to each of these websites in the video notes below. Thank you for watching this video.